Hi friends, welcome to my YouTube channel. So today let us see the sagittal section of head and neck. Before going to the details, let us see what are the structures seen on the mid-sagittal section of head and neck. So here you are seeing the cranium and the brain and spinal cord. So here we have the nasal septum. This is the hard palate and posteriorly we have the soft palate. Below the hard palate we can see the oral cavity with the tongue, and this is the mandible. And here we can see the epiglottis. Today we'll concentrate on the pharynx. The pharynx is a funnel-shaped fibromuscular tube extending from the base of the skull to the esophagus. Okay, and so here this is the base of the skull. The base of the skull is formed by the body of the sphenoid and the basal part of occipital bone. So this is the roof of the pharynx. Okay, and for the descriptive purpose, the pharynx is divided into nasopharynx, oropharynx, and laryngopharynx. The cavity behind the nasal cavity is the nasopharynx, and behind the oral cavity we have the oropharynx, and behind the larynx we have the laryngopharynx. Now let us see the details of each part of the pharynx. Now let us see the details of nasopharynx. What are the boundaries of nasopharynx? The roof of the nasopharynx is formed by the sphenoid and basal part of occipital bone. So this is the floor, and the floor is formed by the soft palate and pharyngeal isthmus. That means the soft palate, that is the uvula, and the posterior wall of the pharynx. This particular junction is known as the pharyngeal isthmus. So the floor is formed by the soft palate and the pharyngeal isthmus. Anterior wall, it is related to the posterior nasal concha. Just like the anterior nasal aperture, we have the posterior nasal aperture. So here we have the posterior nasal aperture. The posterior wall is formed by the C1 vertebra. Remember, posterior wall is continuous with the roof of the nasopharynx, and lateral wall is formed by the medial pterygoid plate of sphenoid bone. The junction between the roof and the posterior wall, there is a collection of lymphotissues, which is known as the nasopharyngeal tonsil or the pharyngeal tonsil. The nasopharyngeal tonsils are predominant in children up to the age of 6, then gradually undergo atrophy till puberty and almost completely disappears by the age of 20. When these nasopharyngeal tonsils get enlarged, that condition is known as the adenoids, which blocks the airway and it leads to mouth breathing. And very important structure which is seen in the lateral wall of the nasopharynx is the medial end of the eustachian tube. So here you are seeing the opening, that is the opening of pharyngotympanic tube or auditory tube, or also known as the eustachian tube. They lie on the lateral wall of the nasopharynx, and the upper and the posterior margin of this opening is bounded by that elevation. What you are seeing is known as the tubal elevation. So here actually clearly you are seeing the opening of the pharyngotympanic tube, and this elevation is known as the tubal elevation. This mucosal fold is known as the tubal elevation. From the anterior and posterior margin of the tubal elevation, there are two mucosal folds. The one which is going forwards is known as salpingo-palatine fold, and the salpingo-palatine fold is formed by a muscle that is known as the levator veli palatini, and the one which is going backwards, this prominent one, is known as the salpingopharyngeal fold, which is formed by the salpingopharyngeus muscle. The superior aspect of this palatopharyngeal fold, there is a deep fossa. Okay, that deep fossa is known as the pharyngeal traces or pharyngeal fossa. It's also known as the fossa of Rosenmuller. Now let us see the oropharynx. The oropharynx lies behind the oral cavity. It extends from the pharyngeal isthmus to the upper border of the epiglottis. What are the boundaries of this oropharynx? The roof is formed by the soft palate and the pharyngeal isthmus. Floor is formed by the posterior one-third or the pharyngeal part of the tongue and the interval between the tongue and the epiglottis. This is the floor, and the anterior wall is incomplete and is formed by the oropharyngeal isthmus. The junction between the oral cavity and the oropharynx is known as the oropharyngeal isthmus, and posterior wall is formed by second and third cervical vertebra. Now let us see the features of oropharynx. The lateral wall of the oropharynx presents palatine tonsil. The palatine tonsil is present in the tonsillar fossa. This is the palatine fossa, and the arch which is formed here is a palatoglossal arch, and the one which you are seeing posteriorly is a palatopharyngeal arch. This is a palatopharyngeal arch and palatoglossal arch. Palatoglossal arch is formed by the muscle palatoglossal muscle, and the palatopharyngeal arch is formed by the palatopharyngeus muscle. And the area in between the tonsillar fossa, this is the anterior wall of the oropharynx. Anterior wall of the pharynx, we have the lingual tonsil, that is the posterior most part of the tongue. There are collection of lymphoid tissues, that is known as the lingual tonsil. And you can see the upper free border of the epiglottis. Just pull this epiglottis. Here you can see this epiglottis is anteriorly connected to the tongue by means of a mucosal fold. Okay, that is known as a glossoepiglottic fold. That is the glossoepiglottic fold. Okay, so we have median glossoepiglottic fold in the midline, that is a median glossoepiglottic fold, and laterally we have the lateral glossoepiglottic fold, and in between the epiglottic valleculae. Now, what do you mean by oropharyngeal isthmus? Oropharyngeal isthmus is a communication between oral cavity to the oropharynx. Now let us see the features of laryngopharynx. What are the boundaries of laryngopharynx? So anterior wall of the laryngopharynx is formed by the laryngeal inlet. So this is the laryngopharynx, this is the larynx, and this is the laryngeal inlet. Posterior wall is formed by C3, C4, C5 and C6 vertebra. And lateral wall is formed by the thyroid cartilage and the thyroid membrane. And what are the features of this laryngopharynx? This is the epiglottis. So here we are seeing the thyroid cartilage. Below we have the cricoid cartilage, and here again you can see the posterior part of the cricoid cartilage. Just above the posterior part of the cricoid cartilage, there is a small cartilage called arytenoid cartilage. Arytenoid cartilage. From the arytenoid cartilage to the epiglottis, there is a mucosal fold. I am just pulling this structure. Okay, so here you can see there is a mucosal fold. This mucosal fold, that is known as the aryepiglottic fold. Aryepiglottic fold. Okay, so here is the aryepiglottic fold, and lateral to it we have the thyroid cartilage and thyroid membrane. Okay, so between this aryepiglottic fold and the thyroid membrane and the thyroid cartilage, there is a mucosal cavity. It is known as the pyriform fossa. Okay, so pyriform fossa, it's deeper in case of ruminants. Along the floor of the pyriform fossa, there a nerve is related. So that is the internal laryngeal nerve. Internal laryngeal nerve. So this pyriform fossa is also known as the smuggler's fossa because it is deepened by the smugglers to hide precious materials such as diamonds. And this, what are the clinical significance of this pyriform fossa? The pyriform fossa are dangerous sites of perforations by an endoscope. A malignant tumor in the laryngopharynx may grow in the space provided by the pyriform fossa without producing any symptoms until the patient presents with metastatic lymphadenopathy. Hope you understand. If you like the video, please like, share and comment, and please subscribe if you are